We're here today with Jill Ward, the Chief Nursing Officer at Novant Health Brunswick Medical Center. Welcome to the show today, Jill.
Thank you, June. It's nice to be here.
Great. Well, for the folks out there who may not have met you already, will you tell them a little bit about your role here at the facility?
Yes, I'm the Chief Nursing Officer for Novant Health Brunswick Medical Center. I've been here about 10 months. My main role is I really look at nursing, and I really look to provide safe patient care and safe interactions throughout the hospital with all of our team members towards our caring of our patients.
Sure, that's great. Well, I'm really excited to be here today. It's all about mobile mammography and 3D mammography. So I know you've been here about a year now, so tell us how things are going.
Things are going very well. I've felt very welcome. The community is awesome. Being close to the beach is really, really lovely. So I'm enjoying it here.
Yes, we all love it here. We're all happy to be here. Well, I'm really excited to learn more today about the mammography services. So I know that some new things were just recently added to the hospital. So let's talk a little bit about those new services.
Okay. Well, we have always been able to screen and do screening mammographies here. We also have always done needle localizations and breast biopsies, but what's new and exciting here at Novant is that we've added to our mammography a 3D capability. So that's what's coming to our citizens of Brunswick County.
Well, that's great. I'm curious, what led the facility to decide to invest in these types of services and this technology?
Well, I think, June, it really takes into account our mission for Novant Health, and we're really here to make sure that our community is healthy, and we want to be able to provide all the latest technologies we can to our citizens. So this is just an additional part of that we can be able to offer this for earlier breast cancer detection.
Yeah, that's great. Well, I understand that there are also funds to help with these services, and let's talk a little bit about those funds.
So our Novant Health Brunswick Medical Center Foundation is very vital and key to this, being able to offer free screenings to our citizens of Brunswick County. So they raise money, and plus they help us with grants, obtain grants. And here recently we got a $24,000 grant with Susan G. Komen Foundation, and also a $10,000 grant through Pfizer Corporation. And this helps us to be able to offer screenings to those citizens or women who that don't have insurance or have financial disparities. So it's something good that we can do here.
Absolutely.
In addition to that, we also have the mobile mammography coach, and we go out into the communities as well. And not everyone can really drive always to the hospital.
That's true.
So
transportation's a problem here in Brunswick County.
And so that way the mobile coach can go out into the communities also and offer screening for women as well.
Well, would the funds be applicable to both the 3D mammo that's in the hospital as well as the mobile coach that travels?
Yes, it would be.
Okay, great. Well, if a woman finds herself in need of those funds, who should she talk to about these funds?
Yeah, she can call the hospital and speak with a scheduling representative. Our number here is 910-721-1485, and those representatives would help them to get scheduled for a screening.
Well, Jill, we've learned a lot about 3D mammo as well as the mobile unit, but let's talk a little bit about what's going on here at the hospital and in the Chief Nursing Officer's role. Let's talk a bit to me about some initiatives that are going on and about the new physicians.
Okay. Well, in our obstetrical area, we are working towards the destination to being baby friendly.
What's that mean?
Well, baby friendly means that we really support the mom with breastfeeding. Also, we when the babies are born, we try to place the baby skin to skin immediately after birth with the mom. So we really focus on that. We're in our third phase. We have 4 to go.
Mm-hmm.
So we have one more phase, and we'll have them in to look at us and see if we can be certified.
Oh, so that's a certification you get?
Yes,
and
it's
you
a
gotta think-
destination, yes.
Oh, a destination.
Yes, and so we can work really close with our families on proper breastfeeding technique.
Well, tell me about that. Do you have somebody who teaches breastfeeding?
We do. We have a lactation consultant here in the hospital that spends a lot of time with the moms after delivery. So, and she's out in the community some as well, and she's really friendly and very eager to help the moms.
That's great. So how about some of the new physicians that have been added?
Yeah, that's exciting too. We've had a lot of growth. We've added a female physician to our OBGYN practice.
Oh, that's awesome.
We've also added a new vascular surgeon as well. And we're almost to having our GI
Yeah, I
office
heard that
open.
there's a new office opening and a endoscopy suites
Yes.
and what have you, just down the road.
Just down the road. So we're very close to the hospital.
So those are a lot of new and exciting things. Well, I understand that there's a new program for nurses, and it's called the Clinical Ladder Program. Tell me a little bit about that.
This program, your nursing staff can climb a clinical ladder, and what that means is that you're hired in at an RN, say you're hired as an RN2, and you can grow to an RN2 or 3, 4, and 5.
Wow.
And it requires a little bit of work, a little bit of research, some committee involvement within the hospital, things that you're passionate about to help the nursing practice. And with each clinical ladder, you get a badge tag that says on your badge what level you are, and it really means that you've put a lot of extra work into your career here at Novant to really grow yourself clinically and to become more educated with whatever practice that you're in. Also, the nurses receive a bonus with that
Great.
each year, so which is really exciting for them to be able to have that.
Well, I heard a couple of things that I believe you initiated, and one of them was the Daisy Award, and then the
The B Award.
B Award. Tell me about that.
Well, at Novant, we think that every daisy needs a bee, and basically the Daisy Award was with the Patrick Barnes Foundation.
Oh, yeah, I've heard of that.
Yes, so it was designated only for RN. So with every RN that works for Novant Health, we always have helpers. We don't do all the work ourselves, and we want to give those team members credit as well. So we looked at this initiative, and the staff here kind of come up with the idea of having a B Award, and that's for any non-nursing team member can be nominated for that. And
So is that how it happens? Everybody, you get nominated for both?
both, you do. You get nominated for both, and
Do they have to write like a...
they do. They have to write it up. If you come into the hospital, you'll see the daisy boxes. They're green with daisy flowers on them. They sit around the nurses' stations and at the front at guest services, and there's little nomination sheets beside them. And the B is right there with it. So you could pull one for each. If you have a team member here that's just really been a great caregiver to you and just exceeded your expectations, we would love for you to fill out a nomination and turn that in.
So a patient could nominate somebody for the B Award?
Yes.
Or the...
the Daisy. It's very patient-driven. It's staff, team member-driven.
Right.
So, yeah.
And are there gifts associated with that? What do you get if you get the Daisy Awards?
With the Daisy Award, the foundation that created the Daisy Award, they give you a discount on your tuition to go back to school
nice.
for college.
Yeah.
If you are an ADN nurse and you want to go back and get your baccalaureate degree, they'll help you with that.
That's great.
You also get put in their register of Daisy
Oh, nice.
recipients, and it's known around the world. So if you're ever a team member and you get that, and you've got a resume builder there, so you can put that on there, and it's really, really nice.
I heard you're going to put in parking spaces.
We have 2 designated parking spaces out in the employee lot where it's closer to the front. So for 1 month, each of those recipients can park there.
And so it's every month you have
Every
a
month.
new one? Oh.
Every month. So we really encourage our team members and our patients and their families to fill out these nominations for our
And
team
where are
members.
those nominations? Are they on each unit?
They
or?
are. They are on both.
So
all
you
the
just
units.
need to ask your,
If you ask,
you're a patient, you just need to ask your nurse or
yes.
somebody for an application. Well, that's really a cool idea.
Yeah.
I like that. I love the parking
Yep.
pass idea.
Yes, we like it.
Well, Jill, it's been great to have you here today. I've learned so much. I love the new innovative ideas that you've brought forward, and I look forward to having you as my guest very soon again.
Thank you.